Here we are on the top floor of the Royal Children's Hospital in the aptly named Butterfly Ward. Now here we look after Victoria's smallest and most fragile of patients, the newborns. In the Neonatal Intensive Care Unit, or NICU, we see over 700 patients a year, and half of those patients have got mechanical ventilation support. That's to help them breathing, and up to 40% of those patients need to have major surgery here at the hospital. Now you can imagine some of these babies, some who may be premature, weigh as little as 400 grams. That's not much more than a can of soft drink. So putting in special lines, IV cannulas, chest drains, catheters, can be a very difficult task. Now here I'm joined by the head of the unit, Dr. Rod Hunt.
Hi, Daniel.
Dr. Hunt, what can you tell us about the NICU here and the kinds of patients that you look after?
Daniel, we've got 32 cots in the neonatal unit here, and about 700 babies a year are admitted to our unit with surgical problems or complex medical problems, and these babies can really only be treated at the Royal Children's Hospital at the moment.
And what are some examples of programs that you initiate here in NICU that are supported by people supporting the Good Friday Appeal?
Look, we have been very lucky over the years, Daniel, to receive the generosity of the Victorian public, and the money raised through the Good Friday Appeal has been incredibly important for us to set up a couple of key programs that allow us to provide excellent care for our babies. One of those would be a follow-up program in which we can follow up the babies that have been on our unit through their childhood to make sure that their development's progressing. And more recently, we've been able to buy equipment to equip our neonatal sleep laboratory so that we can study sleep in newborn babies. And with that equipment, we can make sure that babies who have obstructed breathing are quite safe to go home before we send them home. So that's been a real breakthrough.
Fantastic. Thank you very much.
You're welcome.
Let's meet one of those babies. Now, baby Orla was born at 28 weeks gestation. She was born very early and she had a cyst found in her head. It resulted in a small bleed, which then caused swelling in the brain called hydrocephalus. This was also complicated by more problems where she had some gut issues, had to have part of her bowel removed, and right now baby Orla's going to mum Shannon. She's just a couple of days away before another major operation called a VP shunt, where they put a shunt that goes from the brain to release some of that excess pressure and deliver it safely to the abdomen. Now, mum Shannon, what can you tell us about your experience here in the NICU?
Well, it's obviously been very emotional and traumatic time in a lot of ways, but the experience has certainly been made much more bearable and much more positive by the amazing staff who are here, from the amazing medical staff, the doctors and consultants and the specialists, right through to the nursing staff and also the allied health staff as well.
Now, what are some examples of those allied health staff that you mean? Because a lot of viewers at home don't know exactly how far that holistic care stretches.
Yeah. Well, we've had a lot of dealings with Helen, who's the music therapist. She's been helping, and it's not just music, it's also learning how to interact with your baby in an oral sense. There's been physiotherapists, speech pathologists, a clinical psychologist as well, who sort of is involved in infant and parent mental health, and they have all played a really huge role in helping us to get used to being new parents in a really often stressful environment, and medical, and medicalised environment, very unlike what you'd expect with a newborn baby.
Because we have to remember that they're still babies and they still need to be treated the same way.
Yeah, exactly.
So Orla is a perfect example of why it is so important for you to get on the phones and give that they may grow.